a couple of things. The first thing I'm going to ask is this. You are to turn to someone at the table who you have not introduced yourself and say hello and tell them where you're from. Begin.
Yeah, now we're out of control.
Okay, thank you very much. You may follow this up at lunch. Okay, now, I'd like to officially welcome you to the forum on behalf of the National Academies. And what we do is I want to provide some brief context on the academies and the PPP. The Forum on Public-Private Partnerships for Global Health and Safety is reflective of the growing role of the private sector in contributing to the diverse global health initiatives. The forum seeks to foster a collaborative, that's why you're here, community of multi-sectorial health, safety leaders from private sector companies, governments, foundations, humanitarian and professional organizations, academia. Many of you have come through academia to get here. Some will be going back. And civil society to leverage the strengths of multiple sectors and disciplines to yield benefits for global health and safety. Not just health, but also safety. The forum is premised on the understanding that partnerships among these stakeholders can foster dialogue and knowledge exchange. We can learn to speak the same language, which is incredibly important. When we walk into a room, we may not understand the other, but when we walk out, this will allow us to have a high likelihood of understanding what the other's needs and what is important to them in their day-to-day activities. And we're going to utilize the National Academy's long-established forum mechanism and neutral, evidence-based platform. You can rest assured when you go back and talk to management and colleagues that this is a level playing field. It's all about evidence-based knowledge and the sharing thereof. So I want to thank our forum sponsors who will be listed on the projected slide. And I want to introduce you to, please, it's like a glacier. You see the surface of the glacier, but what has gone on and what is beneath the glacier to bring this to fruition is absolutely astounding. And our two co-chairs are just have brought the energy, the insight, the direction, and really, that sort of strategic approach where they have thought in great detail about why you are here and what you need to take back after this session. I mean, it has been just an honor to watch it take hold and take shape. And they are the co-chairs Ann Ertz, head of Novartis Foundation, and Elaine Gibbons, executive director of the corporate engagement at PATH. And I would also like to thank the other members of the planning committee, Bob Bollinger, Riza Jafari, and Ann Thompson-Quaid. So I'd like to afford them a hand, if you don't mind, as we begin. And have a great day. Thank you. You're on.
Thank you very much. Can everybody hear me okay? Yeah, good. Thank you very much, Claren, for that very kind introduction. And I'd like to extend my own welcome, our welcome to you today on this rainy DC day. Thank you for braving the rain clouds this morning. We hope this is going to be a very interactive workshop, and we're delighted to welcome you all today. I'd also like to welcome the participants that are joining by webcast, and we'll ensure that we take good care of them during the day with opportunities to ask questions, etc. Just a couple of logistics before we talk about the objectives of the workshop, and I'll hand it over to and to give us some context to start the discussion today. There will be lots of time for Q&A, so we really hope that this will be interactive. I know that many of you know each other, so I don't think we're going to have too many challenges with that. We would like to suggest that if you've got questions, for those of you that are at tables with the tent cards, please raise those and we'll have somebody run to bring you a mic. And then for those that don't, please come to the standing mic and we'll take questions as best we can in order. Thank you again to my colleagues on the planning committee per Clarion's introduction. And so I'm going to move to the objectives of the workshop today. We've spent a lot of time, as Clarion mentioned, thinking about how to create a vibrant and engaging discussion about digital health and its potential. And so I hope that that is transmitted today in the panels and in the workshops. So the objectives. We would today like to identify and explore the major challenges and opportunities for developing and implementing digital health strategies within the global, country, and local context. We'd like to frame the case for cross-sector and cross-industry collaboration, engagement, and investment in digital health strategies. We'd like to discuss how health and the health sector can drive other sectors to adopt digital strategies as a common platform. And lastly, we'd like to identify the ecosystem of actors necessary for successful digital health strategies and country and local level solutions for moving forward. So we think we've put together, we hope we've put together today a series of activities that will help us to really think about those objectives and come out with some concrete next actions and discussions. So with that, I'm going to hand it to Anne, who will give you some context and a grounding in the space of digital health, and then we'll open it up for more discussion.
Thank you so much, Elaine, and also from my side, a big warm welcome. Thank you for coming, so many of you, and it's promising to be a very interesting event with all of your brilliant ideas and minds. So why do we want to look at how we can use technology to advance global health today? Well, I don't think I have to tell you, but I feel that digital has been and really is revolutionary for the way we can deliver health services in many, many countries. Not only can you reach many more people in remote areas, you expand coverage, access, but you also increase the quality of care by simply centralizing expertise and coaching less skilled health workers by phone, for example, something that was not imaginable a couple or 10, 15 years ago. So you can really improve quality of care, access of care, and also reduce inefficiencies. You reduce unnecessary referrals to hospitals by coaching a community health worker how the person can better assist a mom to deliver instead of sending the mom on a 9 hours road, a bumpy road to the hospital. So I think I am passionate about digital health, and the main reason, not only this expanding of access, but the main reason is you can give the power in the hands of the patients themselves. You can really empower patients to take more responsibility for their own management of their own health and disease, and you can empower providers by supporting them with clinical decision-making systems. You can send or push through e-learning for continuous education. So there's a lot of ways of how digital has been revolutionary for the way healthcare is provided. And that's led to an enormous increase in beautiful initiatives for digital health over the past 10 years. There's been a rise, I think, in 30% of new initiatives, but many of those remain in a small scale and in a small setting and didn't scale yet, didn't reach scale because they weren't designed for scale or couldn't reach scale for other reasons. And the reasons are that we are currently facing a very fragmented landscape because there's so many of these well-intended initiatives there, unfortunately addressing mainly single health problems, vertical health problems, and not really integrated in the health system. So if we want digital to become really used at its full potential, it has to address the national health priorities and be integrated into the health system. And that's a little problem currently, because there's still so much lack of common standards, there's no interoperability, so all the different systems don't speak to each other. Clarion tells us we will speak the same language when we come out of here, but it's really difficult in digital health to make sure that all the solutions can be plugged into a big health system and speak to each other. On the other hand, there's still a lot of missing technical human capabilities in many low and middle income countries to address the needs in ICT infrastructure and to use the data that come out of all the new possibilities people have on the ground. So that is also something that has to be further developed. And in fact, all of these reasons was the driving force behind our call within the Broadband Commission for Sustainable Development for establishing a working group on digital health to demonstrate or to find out what are the challenges to reach scale with beautiful digital health solutions and to reach digital health systems that address the priorities in a country. And you see here this wonderful group of experts we brought together, both from within the Broadband Commission and from outside the Broadband Commission. We had the world-class experts of digital health around the table, and many of you are here in the room. You see all the logos of the representing organizations here. So I want to thank, first of all those in the room again for participating in this, but it was a real interesting experience. And it resulted in a report that is called Digital Health, a call for government leadership and intergovernmental collaboration between ICT and health, because we feel these were the main things that are still missing in national digital health strategies. But the report was really built on case studies from 8 different countries, ranging from Canada to Norway to Mali, Rwanda, Nigeria, Malaysia, and Philippines. And these case studies represented countries at different stages of the development of their national digital health strategies or the implementation of those strategies. And it was really a useful exercise to go so much in depth in these case studies, of which you will hear many of those again today. The Philippines, Nigeria is represented, and several other countries. So we looked at what are the challenges and the success factors for making a national digital health system work. And the 3 key success factors that we identified out of these case studies was, first of all, you need a visionary leader and a committed leader in the government to really have that aspiration to get to a national digital health strategy, but also to get the funding, sustainable funding for it. That's the first factor, really necessary. The second one is that you need to make sure that the ICT and health sectors can talk to each other, can understand each other, and that your whole ecosystem of digital health players is well defined and has well defined roles and responsibilities to make it a coordinated ecosystem. And last but not least, the third factor is that we need a national framework for ICT, so that standards and interoperability standards, a legal framework, all these things are well defined. Also how departments are going to collaborate between each other. And we found that most of the countries apply one of the 3 different models we identified. And these models for governing a digital health systems are not static. Countries can take elements of the different models and combine it in what they would like to use, or they can shift between one model and another one in the course of their evolution. But some countries go with the health ministry handling it all. The health ministry calls expertise from other ministries to develop it and stays in the driver's seat. It goes for itself that the government has to stay in the driver's seat. But sometimes it's the Ministry of Health, sometimes it's the Ministry of ICT. And sometimes the Ministry of Health in the second model can plug into a government-wide digital system, an e-government system where then health becomes a client of the e-government system. And the third model is where the Ministry of Health is still defining, obviously, what the health priorities in the country are, but they are outsourcing to an independent third-party agency working for them with the top expertise in digital that then establishes the whole national system. So this was, in a nutshell, the real key messages coming out of our case studies and interviews with experts over 40 countries, which is a guidance maybe for countries who are starting to embark on the journey towards national digital health, or who are in the middle of it and stuck, or can learn from insights from other countries and not have to go through the whole pathway themselves maybe. So we brought a couple of copies of the report which are outside. I think, Rachel, you put them here outside on the table. So for those of you who are interested, obviously it's also available online, but some physical hard copies are there. And that brings me to the slide where, in fact, it's Elaine's idea. We should also say that what we are talking about when we speak about digital health, it's true. Because for us, it's like a given that we know what is digital health. But in fact, many people use so many different terminologies that it's worth to define what it will be about today. And it can be called e-health, mHealth, digital health, health information systems. But what it is, it's really about three main things. Either you deliver health information to professionals or consumers of healthcare. Either you use ICT or digital technology to improve the public health services, as I mentioned, you improve quality with continuous education, or you by centralizing expertise and avoiding referrals, other ways of using ICTs. And last but not least, you use it as a health information system in the other direction to capture the data out of the health information. And it makes our surveillance system real time, where all of us who've been working in global health in the past decennia are used to wait for 2 years for the data, the surveillance data coming out in a WHO report. We were planning health services based on 2-year-old data. So nowadays you can plan and adjust your interventions and your priorities based on real-time data. And that's really essential if we want to become more efficient and have better patient outcomes, which is, in the end, the overall goal of digital health. And with that, I will leave it to Elaine again to come to our discussion today.
Thank you. So given that this forum is specifically focused on building public-private partnerships, I'd like to take a moment to think about how we need to consider that framework, that opportunity set within the context of digital health. And given the transformative power and the opportunities to really be a game changer that Anne has outlined, I think it is important to acknowledge, a couple of the central challenges. One is that while it might be a given that, given the nature of digital health, that it's important to have the public and the private sector engaged just by the very definition of the work itself, it's not always clear what the value proposition is for each party engaging in that partnership. It's not always clear what the shared value proposition is for the private sector. So I think we need to really challenge ourselves to be clearer about that. It's also, as Anne has outlined, not always clear what the common guidelines are. Are the best practices clear? Is there a hub for best practice? Is there a sort of a set of agreed upon digital health commons? So those are all components that are required, I think necessary actually, to build effective public-private partnerships. So we need to work together to understand what's needed for countries to realize the full potential of digital health. What are the gaps? What are the funding requirements? Certainly when building PPPs, we need to agree and align efforts around national priorities as well as the global development SDG particularly priorities, and assist governments with the necessary support to be the driver of the digital health strategy. We do need to create a common agenda by bringing together the best minds from business and from technology. It's not just about funding, it's about technical capability, it's about reach. And in addition to the traditional global health players, it's about creating a common set of measures of success. So we need to share what we learn and be frank about what's not working, and we hope to certainly explore some of that today. And lastly, but not least, to Anne's last point here, it's about investment in data availability to increase transparency about funding flows, about outcomes, and importantly, about impact. So those are the things we'd like to certainly consider here today. And you'll hear from a variety of speakers from across a range of disciplines, both from the public sector, from private, from academia. And given that we see in developed countries what the appetite is for investment, certainly from venture capitalists, from social entrepreneurs and others, how can we bring that same commitment and investment to low resource settings into developing countries? So our speakers will share a lot of their insight. They'll talk about how digital technologies are being deployed in countries across continents. We'll hear a lot about particular country level strategies, etc. So we welcome your participation and would like to suggest that you focus on four-ish questions just to get you going. So we'd like to ask you to think about how we can encourage innovation across the spectrum. What system and service innovation, what partnership innovation, so innovation outside of product development, and really thinking about partnership innovation, particularly with non-traditional health players, and innovation that enables us to address the underlying determinants of health. We'd also like you to think about what's needed to ensure that we can proceed to scale, what structures and approaches are needed, what's the technical talent, what's the infrastructure and common practices that are needed. Anne, do you want to give a couple of these other questions?
Oh yeah, we will do a little bit a different format later this morning in the form of a World Cafe. And in fact, we love that format because it gives you all the opportunity to discuss within your groups now where you're sitting. And we saw when Clarion gave you the opportunity to start talking to your neighbor, you didn't know how to stop anymore. So I'm sure this is going to be the best experience of today. Maybe, no. But it's nice because you can all have your voice heard. And there we would like to look at really how can we make digital as the transformation between the different sectors so that our way of addressing global health problems cannot come from the health side only anymore. We have to address the underlying determinants of health, which are for many chronic diseases in any case the same. So we want to hear from you how we can make that work, multidisciplinary, multi-sectorial. You represent different sectors and disciplines. Please voice that discipline in that discussion. And then we will collect those informations to discuss it further.
Great. Anne was really the architect of the World Cafe, so I have to have her speak on that, not me. So last, we'd really just thank you again for participating and really encourage vigorous debate and dissent, if appropriate. So we'll welcome that. And with that, I'm going to turn it over to the first panel. So I'd like to introduce Bob Bollinger, who was also instrumental in the planning of this work. Bob is Professor of Infectious Diseases in the Department of Medicine at Johns Hopkins. So we're delighted to welcome him, and we'll take our place at the table and welcome the panelists up. Thank you.